when I had a group of women, several of them, all in their late 40s, early 50s. And they were developing severe emotional issues. They were getting into depressions, into even bipolar type symptoms, when they didn't have that history before. It was starting at this point. And we didn't seem to be fixing it with our good psychotherapy. We were using the medications, it wasn't fixing the problem. What finally ended up correcting it was balancing their hormones. And then it became very clear that there is, again, this whole other side to health and emotional health, which had to do with hormone balance, including thyroid and adrenal hormones, and nutrition, and the whole biochemistry. I've been largely using the nutritional supplements along with diet, along with removing toxins that are disrupting the system, and with balancing the hormones, whether it's, again, the sex hormones, thyroid, adrenal. And once you're doing that, then you're optimizing the function of the body. You're getting it to function normally. So you're really dealing with the underlying problems that were creating the symptoms, rather than what we were trained for before, which is what can we use to suppress different symptoms. And that was not as satisfying, both from my side and the patient side. The kind of patients that will come to see me really covers the spectrum of almost all of medicine, because the nutritional biochemistry and endocrinology are underlying most of the problems. So it's at least a factor in most of the diseases. So what we get are, again, the range of, again, mostly chronic diseases, including the psychiatric, in children, autism and ADHD, and even going to not just psychiatric, but even to Alzheimer's and other degenerative neurologic diseases like Parkinson's. These patients will come. And again, what we'll do is optimize whatever we can in their bodies. We'll get them with autoimmune diseases. Again, autoimmune diseases are, like most of these others, are resulting from deficiencies in the nutrients they need to regulate their immune system, along with toxins that are disrupting it. So we're really using the same approach. The same thing will occur with cancer. So we're looking at the same factors involved in promoting cancer. The lack of essential nutrients and the overabundance of toxins. And one of the really good multivitamins that I use regularly is the daily essential nutrients. And I use it for several reasons. One of them is that it's very comprehensive. It's covering a lot of territory in one product. Before that, I would end up using a lot of the same nutrients, but it came in 20 different bottles, which was a lot more awkward for people to stick with. So Hardy simplified things by putting a lot of things together in one bottle, but they also gave the right doses. They weren't giving token amounts of things, they were giving real therapeutic doses. And I also like the fact that in general they're using the right forms. So they're using chelated minerals, they're using methyl B12 and methylfolate. They're using the active and more usable forms of them. So it simplified things a lot for me to get one product that will cover a lot of bases. And it was also helpful, I think, that they did have research to back it up. So they did have clinical trials to show we didn't just put nice things in there, that it's actually producing results. So to have that support behind it was also helpful. When we're looking at how nutrition will affect the brain and mood disorders, it's through many different pathways. First of all, the nutrients are both cofactors for enzymes in producing neurotransmitters that you need to regulate brain function. Some of the nutrients are actually precursors for the neurotransmitters themselves. And then we're dealing with a whole other level of oxidative stress and free radical damage going on in the brain that the nutrients can help to neutralize and balance. We're then also dealing with not just nutrients, but again, the hormones, where there's receptors in the brain for pretty much all of the hormones. And those are going to affect how the cells themselves are functioning. It's a little bit vague, but and aside from that, again, we need the nutrients even for detoxification. So when we have things that are getting in there that we don't want in there, again, many of the nutrients are there to help to neutralize, to bind them, to take things back out. And so the nutrition is affecting both the underlying physiology, the chemistry, detoxification, physiology. So almost every aspect of how these brain cells are functioning are going to be affected. In general, the nutrients are not one of the things that doctors are going to look at in treatment. At least it won't be one of the first things, and maybe not one of the things that are going to be looked at all, largely because of our training. It's not what we're trained in. We're not trained in understanding really the nutritional biochemistry. We're not trained in how the different nutrients are going to operate in the body or in the brain. So it's not something we're going to reach for because we really don't know how to use it from our medical training. Doctors that do use it are ones who develop training, if you want, after their medical training. So through places like orthomolecular, functional medicine, naturopathy, these are the places where they will study nutritional biochemistry and they will go to it. But if we're only going to rely on our medical education, it's not something we're going to look at. Nutrition is going to affect the function of all the cells in our body. So it's going to be affecting immune system function. It's going to be affecting heart function, muscle function. It's going to affect pretty much every system in the body. So when you're dealing with these same underlying problems of having insufficient nutrients of different kinds, then physically the cells can't do their job properly. Again, if you're dealing with toxins, the toxins are getting everywhere in the body and disrupting whatever that organ or cell is doing. So this applies to pretty much every disease. An interesting area of, I guess, newer research is looking at mitochondria. So the mitochondria, the part of the cells that generate the energy for them to do whatever job they're doing. And it's interesting when we're looking at most of our chronic diseases, we're finding that at least part of the problem is the mitochondria are not working right. And that seems to be the case in cancers, autoimmune diseases, neurodegenerative diseases. All of them seem to have at least part of their problem is that the mitochondria are not doing their job properly. And they're not doing their job properly because of the same reasons. They're being poisoned, there's toxins that are damaging them, and they're lacking some of the nutrients that they need to function, or they're lacking some very specific things. Certain mitochondrial factors like CoQ10 and PQQ and nicotinamide riboside and alpha lipoic acid, and these are all things that are critical for the functioning. And we're tending to be deficient in most of these things, either because we're not getting enough in, or we're interfering with the production in the body, or depleting them too quickly. So there's a kind of an underlying process, again, that's at least part of almost all of our chronic diseases. And they're, again, nutritionally based. Once we're able to regularly get these nutrients into them, you see the changes. Like I said, usually within a month or so, we'll see them starting to make comments that things are starting to change. 2 months later, 3 months later, there was more benefit. And so it was really a process of getting there. And again, the Hardy products just made it more doable. It made it more manageable. And it made it more likely that they were able to continue longer. I've been using although the daily essential nutrients were developed for psychiatry, for the brain issues, but I use them much broader than that because the nutrients are good for all the tissues in the body. So I regularly use them for my cancer patients, for my patients with autoimmune diseases. I found it very useful for women with osteoporosis because it has such good levels of the minerals in there. So I've been using it, for a wide range of physical issues aside from the psychiatric ones. In general, again, the feedback from patients who are starting on it are much more common with the psychiatric patients, because then there's very clear symptoms. Someone is not going to necessarily notice the difference in their symptoms when I'm treating osteoporosis, because they don't feel anything. It's going to show up on the scans, not on how they're feeling. But with the psychiatric stuff, then we get much more direct feedback. If they're feeling less depressed, if they're feeling less anxiety, if their memory function is improving. For the autistic kids, if we see that their language is improving, if we see their interaction with other people, there's much more kind of concrete symptoms that you can get feedback with the psychiatric side of things. We will get people, though, that that I'm using the daily essential nutrients who don't have any specific illness, if you want. They're just not feeling so good. Their energy's not great. They're dragging. They're not feeling so optimistic. It's much more vague symptoms. And some of them will actually give feedback that that they're noticing clear changes just in their day-to-day life when they're on the nutrients. The time frame that I commonly see is that when we start on the vitamins, they're not going to notice anything much in a day or two. Usually after about a month, sometimes 6 weeks, 2 months, we'll start getting the feedback that it feels like things are changing now. I'm feeling better, or I'm feeling, if you want, less bad. That they're feeling maybe, again, less of the lack of energy, the dragging around, the even hopeless types of feelings. So you see differences in 4 to 6 weeks, although it's the beginning of the change. It doesn't plateau at that point generally. Usually we'll see it continuing to improve over a period of several months. So when we start the daily essential nutrients with the psychiatric patients on medication, we'll get them up to the full dose and keep them on that dose for generally at least 1 to 2 months. And if they look like they're doing well, then that's at the point where we can look at decreasing the medications and hopefully in cooperation with their psychiatrist. And again, it's actually a good sign that there are many of the psychiatrists who are very agreeable to that. If we're looking at the top reported benefits from the daily essential nutrients, the number one would be in terms of benefits to mood. To mood and even cognitive abilities. So that'll probably be the most reported ones. Some of the others have to do with energy. So they feel that their energy and vitality is better when they're on the nutrients, and they feel that it'll also go down when they stop them and they start becoming deficient again. The other things that are, again, less specific will be some of the physical symptoms, especially patients with autoimmune diseases. Although the daily essentials are not the only treatment we use for it, they're part of the program. And when we start losing some of that nutrient support, you will start seeing some autoimmune symptoms recurring, whether that's, bowel symptoms in patients with Crohn's disease or joint symptoms with arthritis. But we will see some of the physical symptoms starting to come back when they start, again, becoming less optimal in those nutrients in their body. So my recommendation for the daily essential nutrients is, because it is comprehensive, because it is using the right doses, the right forms, the right combinations, and so it's giving a lot of what we need in what is really a much more simplified form. So I'm using it so I don't have to try to recreate it with 20, 25 bottles of individual or different groups of supplements. I think that educating, the education of doctors in general is missing a huge area that's important for health. So the whole nutritional biochemistry, the hormone balance, this part of the physiology, the toxicology that's now very prevalent and disrupting us and creating imbalances. And also what's becoming more and more prominent right now is also looking at what's going on with the microbiome. So looking on what's going on inside the bowels as another part really of our physiology. And all of that is being disrupted. So right now, in the way the world is right now, we're deficient in a lot of the nutrients. We're overloaded in the toxins. We've disrupted our microbiome. We've messed with our hormone balance, both in terms of deficiencies and in terms of things that are actual hormone disruptors that we're also getting overloaded with. And this is what's producing, this is what's leading to the breakdown and then the diagnoses of a lot of the diseases, whether there's autoimmune, cancer, psychiatric, neurodegenerative. This is what's underlying a lot of it. And it's a big piece of what's missing in our education of how to deal with that. And until we do deal with those underlying processes, we're not going to get good results with our chronic diseases.